Welcome back to another youth-centered podcast. Today I'm very excited to have a former employee for myself when she was a young high school and college student. And she has obviously over the years has professionally become a therapist working with lots of kids and families in our area. And today we're going to actually be talking about her work with teenagers and the teenage population. So my guest today is Kim Festa Cratty. Kim, thanks for coming on the podcast.
Thanks for inviting me, Rick.
Now, Kim, we've known each other for many, many years, and obviously I'm extremely proud of the woman you've become and mother of children now, married to a great guy, and obviously seen you evolve as a person from that. I never thought you were an insecure high school kid, but you were very active and you were involved with a lot of the programs we did here. And why don't you let people know a little bit about the bio? Obviously, I know you well, but who is Kim Festa Cratty?
Oh, tough question. I moved to North Andover, Massachusetts in third grade and went to Kittredge Elementary. I was a Kittredge kangaroo, and then went to the middle school where I first interacted with North Andover Youth Services at those beloved Teen Co dances, where it was always fun when Rick and the parents used to chaperone those dances. Those were fun. And then went to North Andover High School and played a few sports, soccer, track, basketball. Graduated North Andover High School and worked the summer between high school and Villanova University as a counselor here, doing some summer recreational programs.
In the famous Reach Camp, yes.
Reach Camp. And then went to Villanova for 4 years, worked each summer here at North Andover Youth Services at Reach, and then graduated Villanova. Spent a few years, actually only about a year here locally in North Andover, then moved to Austin, Texas. Here, when I was local in North Andover, I worked for the Department of Social Services, now DCF, out in Salem, Mass. Then transferred out of that agency and into Austin, Texas for Child Protective Services, similar agency, different state, and did investigations for child abuse. And that kind of blew my mind away because Texas approaches Child Protective Services very differently than Massachusetts. So did that for a few years and then became a Longhorn and went to UT Austin and went and got my master's in social work. Did a lot of hospital social work, did psych assessments in ERs, ran some nonviolence prevention groups in the middle schools out in Austin, inner city schools. Worked for like a startup nonprofit doing that, so it was really kind of interesting to develop that curriculum. Worked, with 4 individuals implementing that program into those middle schools and even high schools, and then started doing individual therapy for the city of Austin. Worked there for a number of years, and then moved back to. It was a very difficult decision. We looked for houses in both North Andover and Andover and eventually moved to...
She chose Andover, folks, and we've never let her forget that.
That's right. And after moving back here, that was way too many years ago, 2006, I worked in Lawrence for a while at MSPCC, doing individual therapy in homes in the Merrimack Valley area, but had a lot of patients in Lawrence. And then did ER social work or ER psych assessments in Lawrence General, Holy Family. Gosh, I did even Merrimack Valley Hospital. And then worked for General Psychological Associates for a few days then, and then have continued. So I've been at General Psychological Associates since 2009, doing individual therapy there.
You have an extensive experience in terms of moving into the therapeutic field. Obviously, we joke a lot, and I remember when you were an impressionable 8th, 9th grader, and then obviously working through us. But when did you come to realize, you were a daughter of a DEA official. You were involved a lot with working with police departments as a young person, not being arrested or anything, but obviously with your father's work. And then obviously a lot of the child services you did. When did you decide that you really wanted to get on more of the therapeutic side of everything?
So yeah, I think that is great insight. So with my father was in charge of the Drug Enforcement Administration for New England. So I, spent time in his office. I, knew Bill Brush when he was a kind of a new police officer way back when with the DARE program, Tracy Constigliano. Sure. So I would always kind of go to these DARE activities. So yes, very involved in human services on all areas. And then I don't know if I can actually say this on the air because it's just going to elate Rick's head way too large to fit into this room. But Rick had definitely an impact on my decision to go into the field that I was in. So as we all know, Rick is kind of how can I say it, a facilitator of resources in town, kind of someone who provides individual therapy, right? In a kind of a casual way or kind of an off the cuff. He's someone you can always talk to when you need something. And so during high school, he was someone that I would reach out to and mainly talk about boy troubles, I guess.
Yes, and you had a lot of them back then.
And then working for North Andover Youth Services for the REACH program. So the REACH was you had 12 to 15 kids doing adventure activities out in the environment, out in the community. And so we had great counselors, Nick Savarese, TJ McAloon, Lewis, Jay Schaefer. We all kind of were a group that spent 2 weeks together. So the counselors with the kids, we would take them camping overnight. We would take them to the high ropes course, the low ropes course. We'd go mountain biking in the middle of the woods. We went to state parks all over New England. And so during that process, you got to learn and help the kids that you were with. And so you were processing things all the time. We had circle after all these activities. The low ropes course was such an amazing experience to be a facilitator doing that because you got to see the small group and process all of their activities and learn from that. And so it was that's how I really fell in love with the group experience and individual work.
Yeah, and you did a really great job with that. And I'm happy to say, we continue to do many of those things. And I think you would love our 15-hour staff training we do every summer now with all the 100-plus kids we hire. We do a lot of those old things that you and Nick and Jay and all the crew that you've mentioned definitely did. Let's talk a little bit about your profession right now. You're in practice and you deal with lots of different, you deal with families, you deal with individuals, you deal with a lot of different disciplines. But today I'm interested in talking about your work with teenagers. So at this point in time, you obviously grew up in this community. You've seen North Andover from a lot of different lenses. What are some of our teenagers that you're seeing these days, without getting into any personal cases? What are the issues we're seeing in 2019 that maybe is similar that we were dealing with in 1999 with you, or and some of the ones that are very different these days?
I would say that the world is a very different place than it was 20 years ago. And I see a tremendous amount of anxiety, depression, cutting, suicidal thoughts. But I would say the number one diagnosis is anxiety. I also see a lot of issues dealing with transgender, gender identity issues, learning a lot of new terminology, over the past few years. But yeah, those are the major diagnoses I'm seeing.
Yeah, and obviously a number of those issues were issues we were dealing with when you were a teenager. But, we talk an awful lot about how anxiety is just off the charts now compared to, and anxiety was probably always there, but to the point right now, it's just, it's a different world, as you said, on that. Let's talk a little bit about dealing with some parents that, get into the whole, my child needs some therapy, they need maybe some support service. How does one go about, the referral process? And we talked a little bit off air that, we've got to probably do a better job of, making sure everybody knows what kind of resources are out there, how they access it. How does that process go as when you get a referral?
So as I get a referral or as the patient?
Yeah,
look for it?
Yeah, I guess from both angles.
Okay.
You're getting referrals, so people have actually reached out to you. But what could you give for insight for some of our parents around, how to actually even access to start the process of referral.
So I would definitely start with my insurance company. So you as a parent, go online. They have online provider catalogs, so you can search for different specialties that a provider may have, or just therapists in your area. And that's where I would start. So most insurances pay for individual therapy, and that's probably where I would start. There are some therapists that are private pay only, but I would strongly recommend going for those individuals that take insurance. So that's where I would start, and then I would get a list of those, and then I would look for different specialties. So the big hot button word is cognitive behavioral therapy. That's really a great treatment therapeutic approach that a lot of practitioners utilize, and that really is the preferred treatment approach for anxiety. And I think that is something that I would look for a specialty for a specific therapist if we were talking about anxiety. So going back, look at all the different providers, and then I would start my search, and I would call the different either individual offices, or as I mentioned, I'm part of a group, so you could call the person who answers the phone, the receptionist, and then start from that.
Yeah, we've been doing something now for over 25 years, and you were actually, as a high school and college kid, probably helping us put it together. Kelly started it, and every support services coordinator since then has updated. So every year we do an updated resource guide. The resource guide, Kim is actually in the resource guide, but it's hundreds of therapists, agencies that are actually dealing. We try to give parents and kids a handout. It's a number of different pages, but it'll show, everything from what insurance is accepted to what disciplines people have expertise with, when their agency is open or not open. And it's a really helpful thing. So it's a good start. So from there, obviously people call up, they get their first appointment. One of my questions that I always have for therapists like you, and it's something we've been dealing with since I started here, many of our teenagers just aren't in love with going with therapists right away, and usually their parents are forcing them to go, and they aren't probably at the age cognitively and everything else that they can only understand what the importance of it is right now. What's your approach when you have a kid that's coming into therapy, a teenager that doesn't necessarily want to be there?
I think back on a patient I had a few years back, and they did not want to speak. And so we sat, and I would just talk for most of the time, about, ask them questions about themselves. So there are a lot of teenagers that do like to talk about themselves. So I think my approach is typically for those kind of resistant patients to not force anything, right? To not kind of pry, hey, not have your parents come in and kind of ask the parents why they're there, kind of just have an individual session with just the teenager and talk about, school or whatever they want to talk about. Sometimes we talk about sports if it's a individual interested in sports, but not necessarily go right to that heart of the issue immediately.
So start off with kind of building that relationship.
Exactly.
And how long, in your experience, do you think it takes for a kid, a teenager, to maybe adjust to a therapist? And I'm sure every case is very different, but what's a timeline where that kid who comes in that maybe doesn't really want to be here, how long does it take for you to develop a relationship with that person?
That is a tough question. So I guess it's different, for every individual. But what I would say is you have to give it a few sessions. I would definitely say to give it 3 or 4 sessions with that individual. But as you mentioned, therapy is about the relationship with the therapist. So it's not the therapist kind of giving the patient all this information and the patient walking away with it. It's about the relationship between the two individuals. And so if there's no trust and no rapport built between those two individuals, then the actual therapy can't work or doesn't happen.
Sure. How much involvement, so you're seeing a teenager, a one-on-one, how much involvement do you have with that person's parents, guardian?
Again, depends on the reason for therapy, but I would say oftentimes the parent attends the first session, and we do our intake session. So it's, a lot of historical information, prenatal information, what type of developmental milestones did they hit or not hit when they were young, any learning issues. So we involve the parent because oftentimes the child doesn't remember what they did when they were 3. So medical history, mental health history of parents and parents' families. So all that kind of information is gathered at that first session. So the parent is involved with that first session, but depending on the age of the child, the parent is typically not necessarily involved. Sometimes they pop in the first 5 minutes of each session and just kind of say, hey, listen, I want this to happen, or this is something that got brought up over this past week, and then share that in front of the patient, and then they leave. And then sometimes we involve the parents at the end for planning purposes or homework.
So we've consulted a few times, obviously with a release of information from the child and the parents for us to communicate. How much do you do that with like an organization like mine or the school system? So like in North Andover, would it be normal to have a relationship or at least a communication with other people? Or are you dealing directly with that child and only that child?
So oftentimes we do have a release of information for the schools. And so sometimes that is helpful for 504 plans, for IEP meeting planning, consultation with the counselors. I do a lot of consultation with the counselors at elementary school level, middle school level. If we're talking CBT, kind of coping skills, self-soothing activities, I want to make sure that those patients can utilize the same skills we're working on in individual therapy in the schools. So I connect with the counselor to make sure that there is that kind of common ground between the school and home and in the therapy office. Same with high school. So if oftentimes kids who are having difficulty at home or in the community, they're having difficulty in school. So I will kind of reach out to the counselors at school and just kind of be on the same page, even with the teacher sometimes, like, hey,
Sure.
This is a good way to approach this. This kid is very anxious about X, Y, and Z. Maybe you can help them do these things.
Nice. So a lot of people get confused a little bit, and we talked about at the beginning here is what the youth center does in terms of counseling. We're not a licensed counseling center. When we use the word counseling, it's very informal counseling where we will obviously have relationships with kids. Kids trust us here. Kids are willing to talk to us. And we do our own in terms of minimal assessment. And then we actually work with the parent. And if we feel that we back them up that they need to get some therapy, then we actually work with therapists like yourself to make that happen. So, necessarily, we don't do the actual counseling on site here, but we do a lot of referrals. And that's why it's been great to have a relationship with you and so many of the therapists and psychologists in our area here. And there's a lot of great ones out here, and we try to match up or at least refer to people that have had some real success with maybe some of our kids on that certain area there. So when you deal with one-on-one, there's also other forms of maybe some non-traditional therapy in terms of maybe group work, or maybe there's some therapists that actually do more in-home therapy where you're not coming to the agency per se, but maybe they're coming and doing house visits. What do you see on that type of thing? And are you involved with that at all?
So I do not do group work currently. Obviously, I mentioned I did it in the past. There are some groups out there. Some of them are faith-based groups that I find. Some therapists will do DBT, dialectical behavioral therapy groups. There are some groups that are part of, there's something called partial hospitalization program. So after kind of transitioning out of that, there's a lot of groups that come from there. But I don't know of a ton of groups that are around here, which kind of stinks. The in-home therapy, so it really depends on the type of insurance you have. So Mass Health, a lot of Mass Health products like Mass Behavioral Health Partnership, MBHP, that specific health insurance will pay for home visits. They will reimburse the clinician for home visits for therapy, but most other traditional health insurances do not.
Okay. Let me put you, I said I wasn't going to put you on the spot, but I'm going to put you a little on the spot without obviously getting into individual cases. What's the best day you've had as a therapist working with kids, and then give me the back end of maybe the toughest day of working with a teenager?
Wow, that is kind of tough. So I guess I look back, and this is from a different community and a different state and a different population, but I worked with a teenager who was born HIV positive. And she had a very difficult time kind of embracing that diagnosis. So years ago, I started seeing her, and she was a resistant teen to therapy and to her diagnosis, and her home life was terrible. So I would say that the best day during that time of my therapeutic life was when she was a functioning, happy, well-adjusted teenager. And it took 2 years, but she finally kind of embraced her diagnosis, was taking medication, so she actually didn't have the disease in her body anymore, so she was undetectable, and living on her own, having a job, was in a relationship. And I would say that was
That's awesome.
Yeah, that was very great.
What about the tough day or the frustrating day when it comes to working with a teen?
Suicide attempts.
Sure.
I would say that those are very difficult to deal with. Suicidality is a very real thing, and it's something that a lot of kids struggle with. And so I would say that is the hardest thing to deal with.
For sure. And when you were growing up and heading off to college and everything, we had a really tough time here in North Andover when we lost 2 7th graders to suicide, and how our community reacted to that and some of the things we put into place, but still deal with that on a regular basis here and try to get the kids as much help as we possibly can on that. Let me talk to you a little bit about just the whole opinion of therapy. We started off really talking about that. What would you like to say maybe to the parents that maybe not buy into therapy, or maybe that obstinate teen? Why should someone consider therapy?
It's an outside perspective, and so it's a mediator of sorts, but it's also an outside perspective who can be an advocate and an ally for your child. And so that individual is your child's sounding board. It's someone that is going to have the best interest of your child and work with them on all of their concerns and issues. Oftentimes the child will, or the teen will, disclose a lot of personal information to the therapist that they wouldn't necessarily disclose to the parents. That is also kind of a tricky thing based on the age of the teen as to what is disclosed to the parent. And so there's a lot of rules about confidentiality, and I kind of discussed that at that first session. So, if a child discloses drug use to the therapist is not does not have to disclose that to the parent. And
Sure.
so sometimes that gets a little uncomfortable for the parent. And obviously the therapist would advocate, for honesty with the family, but that is something, at least the therapist will know this information and can help the child or the teen find kind of safe ways to deal with that. And obviously the goal is to decrease the amount of drug use or alcohol use. But I always find that kind of tricky. Same with sexual activity. Oftentimes the child or the teen will disclose that to a therapist, but would not disclose that to a parent.
Sure. Now, you grew up in North Andover, and you've talked, and I appreciate and very grateful for the words you said about, obviously, our relationship and you growing up here. You now live in our sister community of Andover, and you've worked, obviously, with my associate over in Andover, Bill Fahey of the Andover Youth Services. As a therapist, as a person that's actually lived in both communities, what would you say to maybe people like me and Bill in terms of teens this day? What do we need to maybe do more based on the cases that are coming across your desk?
Take it seriously, right? I think, as I mentioned, it's a very different world. So some of the major concerns that I have about our current community is social media. I have 6th graders in my office talking about how kids are getting bullied over social media, texting. It never turns off, right? So our access to technology is great. However, it can be a huge problem in the development of our children. So when we were growing up, we didn't have that type of technology. And so you got bullied in the cafeteria. You didn't get bullied while you were laying in bed at 11 p.m. at night. So I would say take everything seriously. Parent involvement, I think, has increased by 200%. Something recently I observed, I was at a North Andover high school track meet watching my nephew compete, and I was just overwhelmed with the number of fans. And so there were hundreds of parents there. Obviously, me and my entire family were there. And so there's a tremendous amount of support, but there's also a tremendous amount of pressure. So when I was growing up and I was at a soccer game at 4:00 over at Hayes Stadium, there were like 5 parents there, and so there's a tremendous amount of pressure by parents just being that involved in every aspect of the child's life, obviously, but turn that into maybe just being a little bit more supportive as well. So I think that contributes to anxiety. And I also think the access to technology does as well. So I think for you and Bill, which I think you do, is, take all threats seriously. You guys have an amazing, both of you have great buildings. And so kind of pay attention to those individuals that are off to the side and include them, which I think you both do, because I think that's really hard. I hear the phrase friend group all the time. It's really difficult for kids to kind of navigate different friend groups, and once you're kind of part of one friend group, to switch to another, it's hard, and there's a lot of pressure associated with that. So I think you all have kind of some the play here is not always structured, so you have some unstructured time here, and so kind of maybe get involved in that unstructured time to make sure everyone's included. That's
good feedback. Definitely talk to Bill about that too. We need to actually wrap up the podcast shortly, but I got two more questions for you. And you talked pretty eloquently about this, but seeing you grow up from that, and I can say this because I remember you as a middle school kid, kind of an unsure middle school kid, grew into a very confident late high school person, and then obviously off to college. What do you think in growing up in this community and being very close with us, and you're so in the past that you actually still refer to us as North Andover Youth Services when our title is really North Andover Youth and Recreation Services. But what was growing up in North Andover, maybe the school system, your involvement with the youth center, how did that help shape who you are today as a thriving therapist in our region?
I guess something that just popped into my head was the kind of thought of giving back, right? You always had kind of programs where there were mentors, where older kids were hanging out with younger kids in kind of a mentor type situation. There were whoever was employed were running the field trips, were sometimes chaperones at the Tinko dances. I think that was helpful. So in middle school, it was, we had great teachers. I think those, teachers are instrumental in kind of guiding the youth and being supportive for them. They see a lot of things that, parents may not see. So I think having great teachers in the community was helpful. And obviously I don't need to say this to North Andover, but being involved in sports, I think being part of any activities, not necessarily that doesn't have to be sports, but whether it's a robotics club or a chess club, but having a group to participate in events with, I think was really helpful. I look back fondly. I still play soccer with some of the girls I played soccer with in high school, which is really kind of a neat thing. Right.
One of my greatest memories will be driving, and remember the 15-passenger blue vans, which we had the kids, and you in the front seat with Nick Savarese, who's now the executive director of the Doug Flutie Autism Foundation. And you guys were just happy-go-lucky high school kids with Pearl Jam's Black on volume 10 in the van. But those were great days, and obviously you've all gone on to be very successful young adults. Last question for you. We like to give you the final word. What would you say, you talked about a lot of the issues that kids are facing these days, a lot of the stresses, the anxiety is pretty clear. As a final word, what do you say to our parents and to our kids as they go forward in dealing with these issues?
Don't be afraid to have a therapist. I think that it's very helpful to have someone who would be motivated to guide your child towards self-improvement in whatever shape or form that is. I think that we all have something that we can work on or improve on, and I think that third party can really help. It's really important that all youth have the skills that they need to be successful in life, whether it's in college or whatever they transition to after high school. So while they're in your home and in your community, help them have the skills, help them learn how to get the skills that they need to be successful when they're living on their own.
Very well said. Well, you know what I think of you. I love you. You've done amazing work. You continue to do it, and raising a nice young family there. And my only issue with you is you're living in Andover and not North Andover. We'll see if we can adjust that. But thank you very much for coming on the podcast to talk about this issue.
Thanks for having me, Ray.
And as we always end every podcast, we always say, too much passion is not enough passion.